Here, I keep books. Yay, here's one. Let's see what I got here. Managing Your Time, Energy, and Talent in Ministry. That's one of the books I've been reading. Okay, it's pages. You see that? And if I know me, I have things in here. They're underlined in a color. Can you see that? Underlined statements. Little notes to myself. See how I write little notes to myself? What did I write here? Don't like this terminology. It enables me to kind of question what I'm reading. It's on a screen. It takes a little more effort. Look at this one here. I put a big check mark. It says, quote, in a similar way, spiritual endorphins are released within us when we exercise our gifts and talents. Now, I know that must have been the Holy Spirit led me to that page. Spiritual endorphins come from handling a book, come from working with your hands, touching the tangible universe. What's the point of everything being intangible? Things like hugging people and sending love. I'm sick of text messages. If you want to tell me you love me, don't send it in a text, please. You can, but it sounds so much better when I can hear your voice on the phone. And then it's like a gazillion times better when you can tell me face to face. And that's another little caveat. Stop dating via text. Communication was meant to be face to face. And so that's the news. That's the kind of stuff that's in the news. And the last thing that I want to bring up is probably the whole Obamacare thing. There was an article here about the uninsured now just becoming the underinsured. So that's what we're going to talk about, and that's going to be the end of today's entry. Skimpy health law plans leave some underinsured. So this is the deal. Basically, in a nutshell, this article, which was by Ricardo Alonso Zaldivar of the Associated Press, and I won't be looking at the Associated Press always, but it's giving me a good place to start. But it says the annual out-of-pocket costs could still be very high for people who have chronic, expensive care, chronic illnesses, such as patients with cancer and difficult conditions such as multiple sclerosis or Crohn's disease. They can get insurance where they couldn't get it before, but unfortunately, they're going to have still higher out-of-pocket costs unless they get the silver level, which is enables you to get a few discounts, but you still got to pay out of your pocket. You're still not going to be getting the exact care that you would get under employed care. That's what this article says. I didn't make it up. Let's give this example. It says a few numbers tell the story. Take someone under 65 with no access to health insurance on the job and making $24,000 a year, about what many service jobs pay. Under the health care law, that person's premium would be capped below 7% of his income, and that's about $130 a month. It's a stretch on a tight budget, yet doable. That's what the article says. But if he gets really sick or has an accident, his out-of-pocket expenses could go as high as $5,200 a year. Out-of-pocket medical expenses in a worst-case scenario. That's even with the additional financial subsidies that the law provides people with modest incomes and high out-of-pocket costs. So this $5,200 would represent about 20% of this person's income, which is well above a common threshold for being underinsured. So, chronically ill people are likely to be underinsured and face extremely high out-of-pocket costs, according to Caroline Pearson, who tracks the healthcare overhaul for Avalier Health, which is a market research and consulting firm. So basically, you can get some insurance and you'll barely be able to pay for it. But if you actually get sick, you're going to have to pay more out of pocket expense. So in the long run, it's just a big sham like everything else. Not to mention that all of your medical data is then loaded up to the federal government. So you'll be assisting the NSA in giving a complete profile of what's wrong with you. Because they're certainly not looking for what's right with you, because as we know, in this country, anything you say can and will be used against you. So that's it in a nutshell. And you can decide if you think it's a good idea. I spoke to somebody, he's a single male, he's, you know, and a musician, low, varying incomes every month or whatever. And he said he was able to get an affordable plan for about $50 a month. Now, what's his deductible? What if he has to have surgery? I didn't ask him all those details, but it looks like if you get the basic plan, your out-of-pocket costs are much higher. So pretty much that's how it goes. They entice you to go from the bronze level. I think it's let me go back because I want to tell you correctly. Here we go. A bronze plan covers 60% of expected costs. So the low cost part, you're going to get 60% of your expected medical costs covered. The silver covers 70%, the gold covers 80%, and the platinum covers 90%. So none of it is 100% coverage. So you're going to have some kind of out-of-pocket expense. And with only 60% of your expected costs covered, at the bronze level, at the lower payment rate, your out-of-pocket expenses are going to be much higher. My biggest problem with Obamacare is two things, probably three things if I really think about it. I could probably come up with 12, but off the top of my head, one of them is if the government's telling me to do it, I know I don't want to do it because it's not for my good, because nothing they come up with is for our good. That's the first thing. Second of all, HIPAA. Yeah, I don't really want my medical information uploaded to the federal government. I don't want them to know, whatever my health conditions are. But praise God, I don't really have any. But I'm sure they would say, well, she's obese, so she's a threat to the medical community. I don't go to the doctor. I solve all of my medical ills with holistic response, and it works. There is a holistic cure for just about everything on the planet. So, yeah, I got a problem with the HIPAA. I'm not even going to get into the chip part because, the chip that they're talking about, some people say, oh, it's not going to go in your skin. It's not going to go in. You don't know where it's going to go. Because every time they hook you up to an electronic device, your information, that is what it says. I read that myself, way in the fine print. Any medical services you receive where health data is collected from you, that data must be electronically transmitted to the federal government. So if you're a smoker, they're going to know. If you got high cholesterol, they're going to know. If you got a broken toe, they're going to know. If you have a back problem, they're going to know. If you have acid reflux, they're going to know. Okay? So if you don't have a problem with that, then you should get Obamacare, and you should do it quickly. I have a problem with that. I don't want my health records to be available to the federal government, just like I don't want my phone messages and all that. Same as I said before. Because I'm not going to be healthier because the federal government knows what my health conditions are. I'm not going to be healthier as a result of that. And really, this is the third thing. This is all about big business. This is all about more fiat, fake money transactions that they can negotiate with, and have the people that still believe in the stock market betting on. So when they bet on all of these obscure, uh, ambiguous numbers they're going to come up with as a result of all this insurance industry promise, because that's what's going to happen. The insurance industry is just basically turning over all your information. So then they can use that to say, hey, we've got an investment of this much through the Obamacare system. I had a friend once who worked for an insurance company. I will name the insurance company. It was Aflac. And when you get Aflac, it's a supplemental insurance policy that you get once you have coverage through your employer. I wonder what's going to happen to Aflac now that Obamacare has come. But anyway, so I had Aflac, and you pay into it. And Aflac actually pays you for wellness care. So if you go get a mammogram, Aflac would actually pay you something like $75 for going to get a mammogram, which I thought was really cool. So of course, I'm trying to maximize my health care coverage, and I participated in all the wellness care while I was covered by Aflac so that I could get my money back, basically. So I asked my friend who worked for Aflac, what's the percentage of people that actually take advantage of all of this payback and actually use their policy? And the answer was something like 10, 15% of people paying into Aflac actually used or benefited from the insurance. So that's the bigger question about the insurance industry overall. You're going to pay your money into an insurance plan that you probably won't even use. Most people don't even use their insurance that way. And you know why you're not going to use it? Yeah, because it's got high upfront costs that you're going to have to pay. Deductibles that you're going to have to pay. So every time you're confronted with a deductible, you're going to say, I can wait. They said, well, we can give you that surgery, but you're going to have to give us about $1,500 up front. And I guarantee you, if you're broke enough to be going on the Obamacare plan, you're going to be too broke to bust out $1,500 and get the surgery or the care that you actually need. So just think about that. I could be wrong. I probably sound like a fool to somebody who really believes in it. A lot of people say, oh, you know what? Yeah, my mom, my dad, my cousin really benefited because they have conditions that they wouldn't have been able to get Obamacare, health care unless Obamacare existed. Well, I guess if it's good for some, it's good for all. Right? And that's a good way to entice people into participating in really a huge financial Ponzi scheme. And there's going to be a whole lot of people make a whole lot of money off everybody signing up for Obamacare. And why else would they be rushing you to hurry up and do it? Yeah, because they need to have those numbers on paper so they can wow you. Keep that stock market going. They got to come up with some kind of money from somewhere. They're running out of places and options to get it. And then let's always remember, money isn't real. But that's actually another episode. So I'm going to give you all of that to think about. That's a lot. I'm going to post it. If you want to make a comment, great. You disagree with me, great. Because you're supposed to think for yourself. So I don't expect everybody to agree. I'm just putting all this out here, something to think about. And then, the last part of the Obamacare, which is really the first thing I have a problem with, that they don't talk about very much, is it's mandatory. So a person like me who doesn't want to go to the doctor, who wouldn't allow them to inject me with not one needle, no thank you. I don't want nothing that the government offers. I don't want any of these synthetic drugs they come up with. I don't want any of that. So a person like me who has already decided, I'm not going. If it's time for me to go, it's time for me to go. I honestly feel that way. So I don't want to have. I don't want to be a part of that system. I don't. But it's mandatory. It's the law, baby. So maybe I can make like an illegal immigrant and pretend like I don't know it's mandatory. And I sign up. And maybe, like the immigration system, it'll take them 10 or 15, 20 years or whatever to even catch up with knowing that I didn't do that. I don't know. Just saying. So that's the end of episode 2, entry number 2, January 3rd, 2014. Godspeed to all of you. I wish you peace and wellness. Our motto here at Grown Ass Citizens is think for yourself and live free.